And welcome to the Benefit Whisperer podcast, hosted by Ralph Weber. Ralph, good to see you. How are you, my friend?
I'm doing well, thank you. Thank you. How about you?
Very good. So I'd say I'm intrigued, maybe is really stretching it on this topic today, but it's a really important topic. So why don't you lay out what we're talking about in this episode?
Okay, we're talking about the Affordable Care Act and what effect it had on health insurance in this country. And it was one of the monumental pieces of legislation. Some of the other ones are the McCarran-Ferguson Act, the ERISA, there have been several, but this was a big one. And it changed the playing field in many, many ways, forever. Some good, some bad. And we're going to talk about that.
Well, that's good. That's good. And you're right, because I've been in the workplace long enough to realize the incredible changes that it wrought, especially for employers who have to navigate this sort of labyrinth of rules and regulations that the ACA introduced into the workplace, if you will.
Exactly.
So where are we going to start with this one?
The intent of the act, I'm not sure what I kind of know what the intent is. Get more people to have insurance.
Right.
And, the name of the thing was Affordable Care Act, although it did everything but make it more affordable for many people. But it provided subsidies for people that were, in a certain category of earnings on the individual marketplace. So at first there were two mandates at first, the employer mandate and the individual mandate.
Okay.
Now the employer mandate only applied to employers with 50 or more full-time equivalent people. Now full-time equivalent, you could actually have one full-time person and then 1,000 part-time people, but you'd have 50 full-time equivalents because one full-time equivalent person equals one or more people that add up to 130 hours a month or 30 hours a week.
It's not really a person. The definition is not really person. The definition is really hours.
Correct. Yeah, correct.
Mm-hmm.
3 people working 10 hours a week each is one FTE. Mm-hmm. Okay. It's not a full-time employee. It's a full-time equivalent.
Okay.
So a lot of companies that have 20 full-time people think, it doesn't apply to me because I don't have 50 full-time employees. Well, you might have full-time equivalents. Mm-hmm. If you have a lot of part-time people. So that's number one. The individual mandate, which is technically still it's still in place, but it's not being enforced. Okay. The individual mandate said that every individual has to own health insurance or pay a fine. And when they stopped enforcing it, that fine was $695 or 2.5% of your family income. So if you earn $100,000, $2,500 a year, and $695 was the base, right? So that part's no longer being enforced. Okay, some states have an individual mandate, but federally that's no longer enforced. So the other thing it did is to small employers with fewer than 50 employees, it said you cannot, as an employer, you cannot be, all your employees are covered for all pre-existing conditions, okay? And the rate is going to be the same. So if you have 5 people, 49 people, 2 people, doesn't matter how many people. If you have less than 50 people, it doesn't matter what your health conditions are. Your rating, rating that the insurance company places on you is based on age, zip code, and gender. That's it. So what happened is the law of unintended consequences says that when you have a law, what's going to happen is that the really sick people, more of them are going to get group coverage now. So they increase the price. And there's another thing called the medical loss ratio that also increased the price. And I think I've spoken about that before. So what they do is a group with unhealthy people, which is the minority of groups, okay, not the majority. Okay, the minority of groups are benefiting from this law. However, most of them are paying more because of it. Now, they do have some protections. When you get your renewal, it's not based on your claims if you have fewer than 50 people. Okay. When you're initially set up, it's based on ages, genders, and zips only. Okay. Now, we had on our last episode, we talked about level funding. Level funding is the way, kind of the way insurance used to be. It used to be that in every state, they could, not every state, in most states, they could rate the group up or down based on health. In California, they had what they called an RAF, rate adjustment factor, and it could go up or down, by about 10%. In Pennsylvania, it could go up 200%. In Texas, 66%. So every state had a different amount that they could rate the group up or down. Mm-hmm. Now, if I'm an insurance company and I'm selling life insurance to an individual that is 6 feet tall, 185 pounds, in good health, it's going to be a totally different price than if somebody is 5'5", 450 pounds, diabetic, smoker, etc. Okay, we all know that and we accept that. If you're buying insurance on your car and you have a lot of tickets, you're going to pay more. If you're buying insurance on your house and it's in a flood zone, you're going to pay more. We all accept that insurance costs more or less based on risk. Okay, but we wanted to take that out of health insurance. The ACA also said that individuals applying for insurance, number one, you can only apply one time of the year. Okay, for a couple of months, they have open enrollment, unless you have a qualifying event. So you can only apply one time of year, but again, you're not rated up or down based on your health. It's going to be the same if you're super healthy or super unhealthy. It's going to be the same if you're 185 pounds or 585 pounds. So the rate's going to be the same for everybody. They're not going to exclude pre-existing conditions, okay? So those are the things that happened. Now, the groups with 50 or more, you're thinking of a question here, Bill.
I think you're getting to the answer on it, because I was sitting there wondering if that explanation you just finished dealt with the under 50 crowd.
Yes.
Under the 50 employees crowd, as opposed to the larger companies. So, and you just started to go there. So now that question has been moved to the side for a moment.
Yeah. So let me, just before I go to the over 50 crowd, the carriers impose a minimum participation requirement and a minimum contribution requirement. So Bill, you have 30 employees, you want group insurance. I'm going to tell you, number one, you've got to pay 50% of the premium. You've got to pay half for the single employee. Okay.
Okay. So as an employer, just to be clear,
yep,
and you work for me, I've got to pay half of your premium. That's my responsibility.
Correct. The insurance companies have that as a contractual minimum. You have to pay at least half. Number two, you have to have certain participation requirements. So if you have 30 people, you have, and the general rule of thumb is the greater of, and let's say 40 because it's an easier number to work with. It's an even number. Okay. Either 50%, which is 20, or 67, 2/3 of net eligible. So if 10 of your 40 people have the ability to get coverage through a spouse, through a parent, Medicare, Medicaid, VA, et cetera, those are taken out of that pool. So now you're left with 30 and you need 2/3 of 30, which in this case is the same number.
Yeah. Okay.
So if out of your 40 people, and sometimes we have difficulty because there are some industries where almost everybody has access to a plan through their spouse.
That's been what's lurking in my mind. And that was the case for me. For years I carried the insurance. My wife went to work for a company that offered a better insurance plan. And we were like, well, we're going to go with that plan.
Yeah.
So, I could see where it's conceivable that I have 30 people working for me, and 20 of them are not quote unquote eligible and out of the pool because they're insured by other means.
Yeah, and that's where you run into difficulties, because you as an employer, you've got 40 people. Now you're not at the 50 plus where you have to provide coverage, but if you want to provide coverage and you have 40 people and half of them have coverage through a spouse, a parent, whatever, of your 20 people left, unless 100% of them sign up, they're going to say, sorry, it's not enough. Can't do it.
Wow.
Okay. So that's a problem. Now, with the 50 or more, okay, full-time employees, actual full-time employees, if you want to get coverage, sometimes there are differences in participation, because at that point in time, the insurance company gets to give you increases based on your claims. High claims, high increase.
Is that on an individual basis or on a collective basis?
Collective to your company.
Collective to the company, right?
Right. Now, with only 51 people, if your claims are twice your premium, in other words, 200% claims experience, that doesn't mean you're going to get 100 or 200% increase. It's weighted based on the community at large. So you're going to be told, well, you only have 50 people, so your claims experience is not fully credible. So we're going to, give you a part of that increase is going to be based on your claims experience, but a part is going to be based on the community. So when you have 50 or more people, as an employer, you have some mandates. Okay, you have to do the reporting or pay a fine. Then there is the 4980HA penalty and the 4980HB penalty. Okay, the 4980.
This sounds like government at work, Ralph. I'm sorry.
These are parts of the IRC, Internal Revenue Code. So the 4980HA, also sometimes known as the sledgehammer penalty. If you do not offer at least minimum essential coverage, then you have to pay a fine of $2,900 per full-time employee.
Okay.
Per year. Okay. Now the first 30 are excluded. So if you had exactly 50 people, you'd be paying it on 20. If you had 130 people, you'd be paying it on 100 people, et cetera, et cetera.
Gotcha.
Okay. Just like on your individual taxes, you get a basic personal exemption. So your basic personal exemption is your first 30 employees. So then you paid on the rest. The 4980HB penalty, also sometimes known as the tack hammer penalty, kicks in if your plan does not meet standards of minimum value and affordability.
Okay, I'm going to stop you right there because you have not addressed the minimum essential coverage yet.
Okay, that's great.
And so what is that? I mean, and then I'm really curious about the affordability question because it's medicine.
Minimum essential coverage, and I think this is going to be a whole different episode for us, but I'll touch on it really quickly. Basically, when the ACA passed, there were two bills floating, one in the Senate, one in the House. Okay. Normally, a bill starts in the House and then goes up to the Senate for ratification. If you recall, Senator Kennedy died at that time. Okay, when the bill was being floated, this is what I heard. I can't swear to this. I'm not a political commentator, but I heard that they said, hey, the Democrats might not have enough votes in the Senate to pass this bill. So they took the Senate bill that was already passed and pushed it down to the House and passed it through reconciliation. Okay. So instead of the House bill going up to the Senate bill came down to the House. Okay. And because of that, they claim that there were a lot of flaws that weren't worked out because they didn't know if they could pass it again. So they just said, hey, this one's already passed. Let's go with this one. The bill said that each state will set its essential health benefits out of 10 different categories. Those categories are things like drugs, mental health coverage, emergency room coverage, doctor coverage, et cetera, et cetera.
Okay.
And each state can set their own standards. Now, self-insured plans are regulated federally under ERISA by the Department of Labor. There was never anything that said, and the feds for self-insured plans shall set its standards. Okay, because of that, the bare minimum standard was minimum essential coverage, which means there are 78 preventive care services which have to be covered at 100% with no copays, deductibles, cost sharing, et cetera. And the preventive care things are things like annual physical, immunizations, pap smear, mammogram, smoking cessation, colonoscopies, etc. Okay. It's just preventive care. So if you get sick, preventive care isn't going to do anything. This is just to find out if you're sick. So because of that, a self-insured plan can be as small as minimum essential coverage, which, again, is just preventive care. So to get out of the 4980HA penalty, you have to offer at least minimum essential coverage to at least 95% of your full-time employees. Okay. Once you offer that, and a lot of people used to think, well, that's easy. I'll just offer it and I'll have everybody say no. And I'll say, okay, offered it. I'm done. I checked them. No, not quite. The policy actually has to be issued. Okay. Now, you don't have to have 50% of the people. You could actually have one or two people on the plan. Okay. But everybody else has been given the opportunity to enroll and they've said, no, thank you. Okay. Now, the 4980HB penalty kicks in if your plan does not meet minimum value and affordability. Okay. Minimum value is defined as 60% of the regular health expenses actuarially that a person will consume over a year. It's complicated.
No kidding.
I don't know if you can see it behind me, but I've got the Affordable Care Act. I've got a binder. It's 4 inches thick, 907 pages, which I have read cover to cover 3 times. Okay.
I don't know if that's a testament to you, Ralph, or not, but it certainly vouches for the sincerity of the services you offer.
I didn't buy melatonin for a very long time.
Yeah, I believe that. Wow.
So yeah, no, I did read it 3 times, cover to cover, and we create a lot of strategies to help employers. So the affordability part means that your employees can be asked to pay no more in 2025, 9.02% of their income. So if they're making $2,000 a month, you can't ask them for more than $184 or $180.40. Okay. So, I just rounded to 9%, $180. And then there's what they call the minimum safe harbors, about $113. So as long as you don't ask them to pay more than that, it's considered affordable. Now, there's a little bit more to that. Okay. It's actually based on family income. Okay. So you have an employee, let's say that's making minimum wage, who's got a spouse that is a high paid employee, that makes a 6-figure income. Now it's based on
at a different company?
At a different company. Yep.
Okay.
So it's based on family income. You as an employer, all you know is what your employees are paying. You don't know who's got a spouse that earns a lot or a little bit of money. Okay. So you just base it on that. And it's based on the single premium, not the family premium. Okay. So if the single premium is $500 and you've got an employee earning $2,000, you can't have them pay more than $180. Okay. Now, if you say you've got to pay $200 and I'm going to pay $300, or you're going to pay $250 and I'm going to pay $250. So if you do the old 50-50, somebody earning $2,000 can go to the exchange, the healthcare exchange. They can purchase an individual plan on the exchange, and you are fined $4,350 on that employee.
Oh.
Okay. For each and every employee that goes to the exchange.
But this is why people like you exist, Ralph, because I'm sitting here thinking as an employer, I'm thinking, well, John can afford $180 a month. But then he comes in and says, but I have a wife and I have 3 kids. And I'm like thinking, well, that's way more than $180 a month.
Right.
The extra cost on that, if I understand you correctly, becomes my responsibility as the employer, or I face a fine.
Okay, let's talk about that for a second. As long as you're not asking John to pay more than $180 a month, you've fulfilled your obligation.
Right, but I have to pay the rest of that cost, right?
As the employer?
As the employer. No.
You just say, okay, so let's say the single premium is $500 and the family premium is $2,000. Okay, just to pick round
Right,
numbers.
so that's great. Yeah.
If John says, I only earn $2,000, I can't pay my whole wages for health insurance. Okay. Now you have said, of that $500 premium, I'm going to pay $320 of your wife, spouse, children's premium. I'm paying $0. Okay. So John wants to cover himself as a single person. He pays $180. If he wants to cover his whole family, he pays the remainder of the $2,000 less the $320 that you're paying. So he pays $1,680. And he says, I'm only making $2,000. I can't afford $1,680 to cover the whole family. Well, you don't have to cover the whole family. So what's happened is, prior to the ACA, there's a term called the conversion factor, which means out of every employee, there's so many dependents. So a company with 100 employees, the conversion factor was 2.8. So that means you would have 1.8 dependents. So one employee equals 2.8 people. Okay. Now it's under 2. Okay. Because what employers have done is, to make it affordable, they say we're going to pay a higher percentage of the single premium and a lower percentage of the dependent premium.
Gotcha.
So what's happened is fewer dependents are being covered under employer-sponsored health plans.
So the affordability requirement handicaps.
In many cases, it does.
How do I get around that? I come to you and I say, Ralph, I need some help, man. What do we do? What are my options?
Ideally, okay, in the ideal circumstance, if you have a group of, and once you get to where you have more than 50 employees, it's easier. Like if one or two of your employees are not in optimum health, you can still get a self-insured plan, and it's easy to absorb. If you have 2 or 3 or 5 employees, it's much harder. It's going to affect the smaller pool. There's less spreading of risk. So if you have 50, 100, 1,000, okay, you've got your best option in many cases, in almost all cases, is going to be a self-insured plan. Okay. Because that way you're only paying for your claims and expenses, the fixed costs. And you're going to end up, in most cases, saving money if the plan is designed properly. Okay. And on a self-insured plan, because you don't have to offer the 10 essential health benefits, you could carve out whole chunks of benefits. You could say, I'm not covering specialty drugs because they're too expensive. I'm not covering mental health. I'm not covering, you could actually not cover these things on a self-insured plan. Okay. So you have a lot more ability to control costs. Plus you can measure the costs. As a minimum essential coverage versus just paying the sledgehammer penalty, 99.9% of the time makes more sense. It doesn't offer a whole lot of coverage to your employees. It really doesn't.
Right.
But at first, when the ACA passed, employers said, hey, listen, I've got to meet these mandates. I don't have time to jack up my prices and lose customers. So I've got to do the minimum to check the box. And a lot of employers jumped into these plans. Now, years later, they're saying this coverage is not enough. We need more. And then we're growing these into real plans and adding bits and pieces. The other thing that some employers are doing is there are 2 HRA, health reimbursement arrangements, that can cover individual premiums that also can meet the mandate.
Okay. How would I do that?
So if you have, there are 2. One of them is called a QSERA, QSE, HRA, Qualified Small Employer Health Reimbursement Arrangement. The other one's called an ICRA, ICHRA, Individual Coverage Health Reimbursement. And we can have another episode on this too. The QSE HRA is for employers with fewer than 50 employees. The ICRA is for any size of employer. So they can just say, hey, look, we're going to give you an allowance so that you can go to the individual marketplace, take care of your own health plan. It does have some flexibility because some people want a low deductible plan, some people want a high deductible, some want a certain doctor hospital to be in network. Whereas if you have a group plan, it's generally going to have one network or no network. So with an ICRA, you have some flexibility. Okay, because each employee can choose their own. You as an employer have sort of a fixed cost. A lot of employers are going to these kinds of plans. I'm not crazy about them. I think that everything has a time and place where it's the best fit. For some employers, this is the best fit because it allows them to meet the mandate as long as they contribute enough. And, as long as they're meeting that mandate, they're out of potentially one or both fines.
What's the downside? 'Cause I'm thinking, what's the downside on that scenario? Because I'm thinking, as an employer listening to you, I'm thinking, man, it would be better, in quotes, for me to give my employees and say, look, each of you've got $1,000. I will contribute $1,000 a month.
Mm-hmm.
Then I know that my cost, or if I have 40 employees, my cost of $40,000 a month, and I can put that on a spreadsheet, and I can do something with that, right?
Mm-hmm.
So why would I not want to do that?
That is the upside. Here's the downside. The individual plans, number one, state by state, there are some limitations. For example, in Texas, you can only buy an HMO plan. Okay.
Gotcha.
So some places are not in network. Okay. Number two, because it's guaranteed issue, it's priced not for healthy people, it's priced for people of less than optimum health. Okay. Whereas a self-insured plan, over time, it works out to what your actual costs are, whereas an individual plan doesn't. Okay. So in some cases, it could cost a lot more.
Wow.
There are pros and cons, and that's why, I talked about being an air traffic controller.
And I realized this podcast could go on for another 2 hours, as a matter of fact, just talking about this particular issue.
Yes.
And I don't know that anybody has the fortitude to do 2 hours on this topic.
No.
But so where else can we go? What are the other things that you would advise me to look at as an employer, avoiding the penalties and everything else?
So start with, at the bare minimum essential coverage. But again, that's not enough. That's preventive care only. Look at a healthcare reimbursement that reimburses people for individual premiums. Look at self-insured plans, level funded or otherwise. And fully insured plans are there. The upside to the fully insured plan is it will cover an employer regardless of the health of their people, for small employers under 50. And small employers under 50 employees have a whole different set of rules than those over 50.
Yeah, and and I've talked about this because I do know folks who own small businesses, and despite the predilection of some people to paint business owners as bad people, I know for a fact, because I know them, that they are bothered deeply by the fact that it's they really want to take care of their employees.
Absolutely.
They really genuinely do, and they lose sleep over the fact that it's man, it is such an enormous cost for them.
It is. It's huge. It's huge. And they have to factor that in because, in a nutshell, it's $16,000 per employee is the cost of health insurance between the employer and employer combined for next year. Rough numbers.
That's an annual number?
That's an annual number. Okay. So if you have 100 employees, you're paying $1.6 million per year. Okay. For family, it's over $24,000. So I might as well say, if I hire Bill and he's got a family, I need to add $2,000 a month onto his, wages.
Right.
So if I think I'm getting away with hiring Bill for $100,000, it's actually $124,000. So, that factors in, and the cost is high. There are ways to reduce it. And I've got, a lot of case studies where we've reduced it year after year after year, but it takes a lot of work. It takes a lot of expertise and a lot of, spinning the plates and keeping them going.
Yeah, and I would imagine, this sounds so obvious, I hate to say it, but my situation is going to be very different from Joan's situation and from Fred's situation, right?
Yep, exactly. And, that needs to be taken into account. Sometimes I I had one prospective employer that I spoke to that had 370 people, 86 in management, and the rest were, hourly paid workers. The management plan, their broker had moved them from one kind of plan to another kind of plan to another kind of plan 3 years in a row. And the poor HR manager was pulling her hair out. And every year she had to re-educate her people. Everything I told you last year, forget all about it. There's a whole new plan. And by the time I talked to them, they were so burned out from changing, even though what I proposed was a great solution long-term. She was just like, I just need, to press the easy button. I want to press the easy button.
Right.
I don't care if it costs more. I'm done explaining this. So, and I get her pain. I totally do.
And I get her pain too, because you looking at it from the employee's standpoint, they're like,
yeah,
I could do better than this, or I mean, it's a reason to start looking for another opportunity.
Absolutely. Absolutely. And you want to retain key talent. You need to be competitive. Take care of your people. They'll take care of your customers.
We've covered a lot.
Yes.
Here in this episode. And I hope that we've covered enough that it intrigues people to think about this topic and think maybe they should reach out and maybe have a conversation with you, Ralph. What is the best way for somebody who's interested in getting in touch with you or discussing these issues? How do they do that?
Well, they can email me, ralph@thebenefitwhisperer.com, or they can call 832-924-3330.
Great. And if you're listening to this and you're not able to grab a pencil to write that down, it's in the show notes. So when you have the opportunity, you can go look in the show notes. The phone number will be there, as will the email. And I would encourage you to do that, by the way. I would very much encourage you to do that. I also would encourage you, if you like this podcast, or maybe you're not an employer, but people who own their own business or people who are employers, share this podcast with them. There's a pretty good chance that Ralph could maybe do something for them as well and help them out. And we'd thank you for spreading the word about the podcast. Until next time, I'm Bill Tucker. On behalf of Ralph and everybody at Route 3, I want to thank you for taking the time to listen today. And I will remind you that you can go out today and make today a great day or not. The choice is yours. Use it wisely. Thank you for your time. Until next time.
Thank you for listening to the Benefit Whisperer podcast. Click the follow button to be notified when new episodes become available. Looking to reach out? Visit our website at www.thebenefitwhisperer.com or give us a call at 832-924-3330. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of the Benefit Whisperer. The content has been made available for informational and educational purposes only. The content is not intended to be used as a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning.